No. We don't need to do that. Do I need to add her? Okay.
Hi.
Hi.
How are you?
Hi. Good. How are you?
How's everything? Good.
Good. Okay. We're so excited to get started now. Hi, everybody. Welcome to our live. This is Laura. She is a mom, a doula, and co-owner of the Nesting Place. And she's going to be talking about how to stay empowered, planning to become, I'm sorry, I'm getting a brain fart.
That's okay.
or mom brain.
I'm
She's
not.
going to be talking about planning for an empowered birth experience.
Awesome.
So take it away.
Yeah, thanks. So I teach some of the childbirth education classes here, and I think that every mom needs like the basics, right? Like everyone, I feel like needs some basic information, foundational information before they have their babies, and unfortunately, they don't receive a lot of that information from their care team usually. Whether that's an OB practice or a midwife, like they just don't have that like time to sit there and explain sort of the birthing process. So I like to keep it simple, really, So number one, I think, is to help people really find the desire to relax into their labor, which is super helpful for letting the process unfold. They need to understand like what's happening inside their body in the first place, because I think that it really helps to have that understanding of like, why is this happening? Why is it good to have these intense surges, right? So walking them through that, and I'll just do some of that now. So um, basically, childbirth is broken down into three phases. So the first phase is really the labor phase. And inside that phase, or inside that stage, is three phases. So it's early labor, it's active labor, and then it's transition, right? So that all encompassing is like labor itself. And I think when we just hear labor. We don't hear about like all these individual sort of breakouts of labor. And I think that's really important, because what I find, especially for first timers, is that they're like, oh, I'm in labor, and then they go to the hospital. So helping people to understand like what are those phases and what to expect from each one. So for example, in early labor, that's really when your things are really just getting started. And a lot of times people mistake like Braxton Hicks for early labor, and that's because it's manageable. So the good news is, for early labor, you can kind of be at home and do all the things that you would normally do, whether it be go for a walk, which is really great, eating, drinking, emptying your bladder. And a super important piece to this that I stress over and over again is rest. That's a huge part of early labor, because you're going to need that rest later. And in the next sort of phase, it's harder to rest. In addition to that, it's harder to rest once you're at the hospital, if that's where you're having your baby, right?
Yeah, I wish I would have known that, because as soon as I felt like I was like labor, and it's like, let's go. My husband was like, freaking out, let's go. And I was like, okay.
Yeah.
It's just everything just gets so hectic, and you don't realize that you could actually stay home and just relax for a little bit before you go to the hospital.
And even if it's, the middle of the day, just taking like a 30-minute nap, because you may not sleep, like if things pick up, you may not sleep that entire next night. Similarly, if you feel like your early labor is starting in the middle of the night, it's nighttime, right? So I always encourage my clients, like, if it's the middle of the night, pretend like it's like, be in the middle of the night, like go back to sleep.
Maybe like the hospital's closed.
Right, exactly. Yeah, totally. Because again, like you may only get like a few hours of sleep, and if it kind of goes away and you sleep the rest of that night, like that's great for you for the next day. Because sometimes people, like, things start to pick up the next day or even the following night, because what we find is a lot of times, like, once the sun goes down, our bodies go into this like primal brain state where the labor starts up again, right? So getting in those naps whenever you can in early labor is so important. And we know that people get like really excited, or even like maybe their water breaks and they're like, oh, I'm in labor, I gotta go, to the hospital. But I'm always like, try to rest, try to take a nap, like do those things you can do while you can still do them. And so nourishment, not as much. And we hear so much about like being active, and that is important, but we want to save being active for just that active labor. So that kind of brings us to the next phase, which is active labor. And that's when your labor starts to get into a really nice pattern. Things start to maybe pick up. You feel a big shift, right? So the contractions in early labor are much more manageable, and you don't really need to kind of focus on the breathing, getting through each one of them. You're able to kind of go about your thing and breathe naturally. Whereas in active labor, we see moms start to go inward, right? They really need to focus within, and they're having a little bit harder of a time, like maybe walking through them or breathing through them. And so they start to build that focus. And in active labor, you know, we want to make sure it's sticking around. So that's when the question comes up, like, is it time to go to the hospital? What I always say is, like, let's just make sure it's sticking around in active labor, right? Because we want it to get into this real nice active pattern that isn't going to go away the second we step into this like bright facility that's sterile, in an environment that may not be like, you know, that supportive of this like instinctual birthing process that we need for our bodies to open up and unfold and let labor do its thing.
Mm-hmm. Now, in early labor, are you dilated at all?
So early labor is usually like when you're going from either 0 or whatever kind of you started at. Like some people, we see that people, you know, are dilated a little bit before labor even begins, which is great. But your cervix is starting to soften and open up to around like 4 to 5 centimeters. And then the active labor is when we see it, your cervix is opening from like 5 to 7, around 7 centimeters. So that's what they're measuring when they do the, you know, the internal exams to kind of see how soft is your cervix, how much is it opening, where is the baby's head in relation to your pelvis. So looking for that station is what they call it, to see, you know, where is the baby, is there optimal pressure on the cervix so that when we have these contractions, they're actually making progress. But again, like I think people also have this like need to go get checked, right? They kind of want to know, where am I at? Right.
100%. Yeah. And I'm sure people Google things and it's like, go to the hospital.
Right. Is like, if you suspect you're in labor, go to the hospital. And you know, I think it makes so much sense. Like even myself, when I was in labor, I was like so curious. I'm like, I just want to know where I'm at. I've been doing this for 12 hours. Like, where am I? You know, but it seems like a lot of times people get like stuck there. Like for some reason you have to stay, you know? So I always encourage my clients, try to labor at home as long as you can. But ultimately the birthing person is the one who decides when to go. So there are a couple things, like we want to look for that nice labor pattern. You know, and then of course there may be other like indicators that you may need to go to the hospital for. So for example, if excessive bleeding, like if you have excessive bleeding, like some bleeding is normal during labor, because we see like as the cervix softens and opens, some of that bleeding is normal, like that mucousy blood, right? But if you feel like it's heavy bleeding, then I would say go to the hospital. In addition to that, if your water is released, right? So if you're more commonly known as like your water breaks and it's tinted like a green color, that would be a sign to go get checked out at the hospital, because that could mean that the baby had a bowel movement in utero, and that could be a sign of distress. So just a couple things to look out for, aside from that like real nice pattern combined with mom's intuition saying like, it's time to go. I feel like I need to go, because when we think about it, some people may not be feeling safe laboring at home. So that's kind of counterproductive too.
Right. When does usually the water break? Like in which stage? Yeah. Somebody had a question about this.
Yeah. So it really doesn't, it varies from person to person. Some people's water doesn't break at all. So either the provider breaks it for them with a little tool, or they just let them have the baby we call it in call, right? So it's like the baby's born in the center. So it really varies from person to person. Sometimes the water breaks before labor starts.
Right.
And they're not even in labor. It's just their water breaks, and that's kind of the first sign that they want to try to get things going. But it doesn't really match up to any sort of stage of labor.
Right. And it's not always like a whoosh that you see in movies, right? It's just like it could trickle out, or it could just come out a little bit.
Exactly.
Yeah.
Yeah. And I think that a lot of people mistake, right? They're like, I don't know if my water broke. And like I always say, the easiest way to know is if you feel like your water broke and it's just like a little bit of a trickle and you're not really sure, go empty your bladder. Go empty your bladder, make sure that that's empty, because if it is, like, if your water has broken, it will continuously drip. So if your bladder is empty and you feel another, like, even if it's like a minor gush or a little trickle that continues, it's probably that your water has released, and it may be like a high break, and that's why the trickle.
Okay.
Someone just asked if it smells. No, typically not, and that would be something to kind of look out for. But amniotic fluid shouldn't smell, like at least healthy amniotic fluid.
Okay, thank you.
And then moving on to, the transitional phase of labor, right? So this is when we've gotten through the active labor phase. Our cervix has now softened almost completely. So we're looking at a percentage in the softening. So when you start labor, you can be anywhere from 0% effaced to, some people start labor at 50% effaced. And then by transition, you should be 100% effaced. Your cervix is nice and thin and now completely ready to open up for that baby. So that's when you're really going from 7 to 10 centimeters dilated, and the baby has now enough room to start passing through the birth canal. And transition can be the most intense phase of labor for most people, but the good news is it's also the shortest phase. But this is when people start to feel like feelings of self-doubt. It can be really scary because you're about to push this baby out, and this surge of hormones. And we also go into this like expulsion mode. So it's very common for people to vomit when they're in transition. They also have that like hormone surge. So some people shake. It is kind of an intense phase.
Yep.
So one tip for that would be like just to stay as active as possible. So changing positions can be really helpful in this phase. And then really just relying heavily on the support team and making sure that the support team and, a doula and your partner and a good care team will know that a birthing person really kind of needs to go into this like primal zone. Right. So you see people really start to turn inward and tap into some of those primal noises. So, and when we say noise, I think we think about maybe people screaming in labor, but that's not productive, and it's not helpful. It's also not primal. That's more like a fear-based noise. And so I always encourage my clients to use those like low, slow vowel sounds like oh, those things can help us stay soft and relax and let things kind of unfold.
Do you have any tips for making the environment just a little bit more calmer, like a certain type of music or like I don't know, some kind of thing or like a pillow or something like stuff like that?
Yeah. So I think one thing that's really helpful is from a partner perspective, like making sure those lights are always dimmed, because what happens sometimes is, especially if you're birthing in a hospital, the team will walk in to check something or take your blood pressure or whatever it be. They flick all the lights on and someone forgets to turn them off. And for a birthing person, like they may not remember or they may not even ask for that. And so that's just a really simple way to allow the birthing person to kind of be in this safer environment where she can kind of go inward. And then like I always like the little fairy lights that can be really nice and just like tranquil in the room. Bringing some affirmation cards can be really helpful for the environment. It's not only related to sound, so hearing the affirmations, like the partner, the support team can read those things, but they can also look at them. Another thing that's really nice is essential oils. Those things can be really, really wonderful in labor, and you can bring a variety, because sometimes you want that like soothing relaxation like lavender oil, but sometimes you want like something like orange because you need like a little pick-me-up. So having like a nice kit of essential oils can be a really good tip. Can be really great. And then another one is like simple things like brushing your teeth. I know that sounds really bizarre, but like just like how your mouth tastes can really affect your mindset. And so having like a refreshed mouth can give you, same thing with like the orange. It's just like a little pick-me-up. I also always carry honey sticks. So that can be a little boost if someone is starting to feel depleted. So like all those little things can really add up and make somebody feel just a little more comfortable.
Now, do you recommend in early labor to eat before, like going to the hospital and everything too?
Oh yeah. So early labor is all about that, like nourishment, the rest. So eating, drink as much as you can, because what happens sometimes is we have false labor contractions or not as productive contractions if we're feeling, if we're dehydrated. So making sure that you're hydrated, eating, emptying your bladder, as I mentioned, and rest. Those are like the big parts for early labor.
Right.
And things that people don't do enough. Like, it sounds so simple, but it's something.
Yeah, no, it's true. It sounds simple, but when it's actually happening, it's like, okay, what do I have to do? I don't know. I just have to grab my bag and to go to the hospital, you know?
Yeah. Or you just think it's like, it's so simple that like, how could this be that helpful? But it really is.
Yeah.
And that's the thing about birth, right? Like, I always try to tell my clients, I'm like, it's not this, like, there's not like this secret tool to it, right? It's literally just letting the process unfold the way that it's meant to is our biggest tool for labor. And so much of that is having the person be comfortable, and breathing, you know, so that breath work is another huge component to this. And even breath doesn't have to be complicated, right? So just those like slow, low abdominal breaths are such a huge key to labor. It doesn't have to be this like, you know, Lamaze breathing or these like tools and techniques that are so complicated, because sometimes when we do that and we learn those things, or we try to learn those things, we almost like question what our natural breath is telling us to do, because we're like, oh, maybe I should be doing something else.
Right. Yeah. Your motherly instincts start as soon as that labor starts.
Exactly. Exactly. It's like you're born knowing how to give birth. It's really incredible. It's really just having the wherewithal to like let the process actually unfold the way it should. And unfortunately, we have to kind of recreate some of that because of the places that we give birth, which is for most people in a hospital.
Yeah. Okay. But we can definitely make that environment a little bit more calming, as you had said before. So
exactly.
Those are good tips. Yeah.
And having a doula will be a great way to do that too, because you know, that person is there. That's like their number one job, right? To like make sure mom, birthing person is comfortable, and that the environment is one that she can just zone out and get into her her work, you know, and really let things unfold.
Yeah.
It's a beautiful thing.
It is. Definitely. Okay. Do we have any other questions from anybody? Nothing coming in right now. Do you have anything else that you want to say?
Yeah, the one thing I wanted to mention was, I know we talked a little bit about like informed consent, right? And so giving yourself the opportunity, no matter where you are in your pregnancy or in labor, to kind of sit back and make an informed choice. And there's a really great way to do that. And it's a really easy acronym to remember. It's called BRAIN. And it really is like it's 5 things to do every time that something is presented to you as an option, to make sure that you walk away feeling like you made an informed choice. So it's BRAIN. So it's benefits, risks, alternatives, intuition, and nothing, right? So right. So it's, what are the benefits to what you're, you know, suggesting or proposing? What are the risks associated with what you're proposing? Are there any alternatives? What is my intuition telling me? And what if we do nothing? Like, what if we just wait a day, an hour, a week? And this is something that you can start practicing now. And I don't think that it's something that can be used just for pregnancy or birth. It's something we can use for any sort of medical care, just so that we feel like we're involved in the decision-making process. And I find it's really helpful for like when I take my kids to the pediatrician too, you know, so that I feel like, oh, I had to say in that choice for my child.
Yeah, I can definitely see how that helps.
Now, say if you're past your due date, now I know a lot of people nowadays that get induced. So would you consider that, like, would they go through the stages of those 3 stages?
Absolutely. So you mean for an induction, would they go through?
Yeah.
Yeah, absolutely. So, you know, an induction is really mimicking exactly what our body wants to do in natural labor. It's just that the tricky part is you're doing all of that early laboring in the hospital,
Mm-hmm.
So it's a little bit harder to navigate, but it's definitely possible. And your care team will want to see things unfold just as slowly as it would in regular labor, right? Because that means that it's safer for you and your body. They don't want to like, you know, hit you hard with anything, which is why we want to do the softening of the cervix first, which is a lot of times done with what we call Cervidil or Cytotec. That's like the pharmaceutical drug that's used to soften up the cervix. And then there's some alternatives to that too. Like I've seen like the midwives, they use a Foley balloon where it's actually something that goes inside of your cervix and almost like manually dilates your cervix.
Oh, wow.
So that's something that's possible, but it's not like a drug that you're taking. So some people like that option. And then Pitocin, right? So Pitocin is the thing you hear probably all the time.
Yeah.
And essentially it's a synthetic form of oxytocin, and oxytocin is the hormone that causes contractions. So it's really just looking to mimic what your body would do in labor. So we're looking for the labor to mimic that too.
Okay. Good to know.
Okay, thank you. That's really awesome advice.
Yeah, and if anybody wants to take, we have a few options for like the childbirth prep class that goes into more detail on all of what we've discussed, with just more like tangible tools and coping skills and things. We teach those here once a month. We also have a hypnobirthing class. The next one starts on April 28th. So registration is open for that. And we also do like a 6-part series, which I know you guys came to, and, you know, to give people more information on different topics. So outside of just childbirth ed, but CPR and newborn care and infant feeding, you know, breast and bottle feeding and all different topics. So we have a ton of those offerings.
Yeah, you guys have a great facility over there.
Yeah.
A whole benefit, all those benefits for moms and just overall wellness care. So we really love what you do over there.
Especially the 4th trimester classes. Those
Yeah.
are really helpful.
Yeah, we have one right now in the back started.
Oh, cool. And then you have those virtually as well. That's the one that I did. Yeah.
Yep,
It was
exactly.
really great.
Yeah. Well, I'm so glad you were part of that.
Yeah, it was really fun. And then some of the moms, we have like a texting thread. We still keep in touch and stuff. It's really nice. Yeah.
I love that. Yeah, a lot of the groups still keep in touch and like go on walks, or now they're meeting up here for baby and knee yoga and things like that. So it's really good to build that like foundational community even you know beforehand, and we see that
Definitely.
a lot of the
Yeah, and especially last year when I did the postpartum class, it was like really still like COVID, like lockdown, like, you know, and it's great that you had that virtual option, and now that people are getting out more, so it's a good thing too. So that kind of built community, you know, virtually, and now, you know, you can see people outside more and then in your facility as well. So that's really great.
Yeah, and we also have a prenatal support circle too. So that's a 6-week similar model. So it's 6 weeks, but it's for expectant people instead of postpartum. So it's real. That's
been nice. Okay, really good.
Yeah. Well, thank you so much for having me.
Oh, thank you so much for coming on here and doing the work that you do and talking and taking the time to talk about all of that, pregnancy and labor and everything. Yeah, we really appreciate it. And we'll talk to you soon.
All right, sounds good.
Okay, bye everybody.
Bye.
Thank you.